We were mainly interested in looking at androgen deprivation therapy for prostate cancer because it's such a common therapy for a very common cancer. It's estimated that over 500,000 men in the United States are taking androgen deprivation therapy. And through the 1990s, there was a tremendous growth in the use of this therapy, both in situations where there was clear evidence for benefit, but also in situations where it was unclear what the benefits would be. And there were concerns that because use of that therapy was quite profitable for physicians, that some of the use was driven by that. So what happened in 2003 was that the Medicare Modernization Act was passed, which led to substantial cuts in the reimbursements for androgen deprivation therapy that took place in 2004 and 2005. And we were interested in looking at what happened to use of the therapy over that period of time. We used a database that contains Medicare claims and cancer data to look at what happened to patterns of use of androgen deprivation therapy from 2003 through 2005. And we divided use of the therapy into three general categories. One was use of therapy where it was clearly indicated and beneficial for men. One category was where there wasn't clear evidence of benefit, where use of the therapy is potentially unnecessary. And then we had an intermediate category. And what we found was that over the period from 2003 to 2005, as there were reductions in reimbursement for the therapy, there were very dramatic and sharp declines in use of the androgen deprivation in settings where the therapy was not potentially beneficial or was potentially unnecessary. Whereas use in situations where it was clearly beneficial essentially was maintained. And scenarios where there was an intermediate level of evidence for its use, there was kind of a more moderate decline in use of therapy. So we felt that one of the main takeaway points from this study was that with cuts in reimbursement, that there can be positive changes in how healthcare is delivered. Essentially what happened is that Medicare paid out about $1 billion in 2003 for androgen deprivation therapy, and that was cut to somewhere around $400 million in 2005. And despite those cuts, what we found was that the use in men that could really stand to benefit from the therapy was maintained, and that most of the cuts in use occurred in settings where there wasn't necessarily a clear evidence of benefit, where it might have been potentially unnecessary.